walk you through our most common procedure today. It's actually the most common procedure in America. That is Lipo 360. Now, traditionally, liposuction was removing fat on people who were looking for an easy way out. Now, we are sculpting bodies. We take care of patients who take care of themselves. They eat well, they exercise, they have stubborn areas. We put in the details into the pre-op. We go over the top on the details in surgery and post-operative details. And we're going to show you everything. So Lipo 360 is typically from sculpting from basically from the breast to the groin all the way around, creating balance and harmony in all those aesthetic units. We're going to show you the technology that we use to melt fat, the technology we use to remove fat, technology we use to tighten skin, and how it all comes together. Let's go do the procedure and on to the markings. All right. We're going to be doing Lipo 360 today along with the inner and outer thighs. Super common procedure to help people achieve their ideal aesthetics. Now, this patient eats well, she exercises, she's super happy and confident in her body, but she really just wants a little bit of finesse help from us to go to the next level. As you can see, she has great muscle definition, and there's just some stubborn areas really centralized around the belly button, and this can be incredibly stubborn for many people, genetically programmed for the fat to survive. So she has a low body fat percentage, but the body fat that she does have is stuck in certain areas. We're also going to help optimize her waist and make her feel like her legs are longer and leaner. Now, I always start by marking the midline. This is between the two rectus muscles, and then it's super important to mark where the upper aspect of the abdomen is, and that's really the lower aspect of the ribs. This area between the breast and the ribs, I like to really clean out. We're going to go through that in detail in the operating room, because that is something that is incredibly stubborn and frustrating for women, but looks amazing aesthetically. Now we divide the rectus and the oblique, and this is really, we're trying to create a little bit of a hill and valley concept here. Because what that's going to do is give you those really long, lean, sexy aesthetic lines. Now, if people want a six-pack, I tell them, I'll bring the skin down to the muscle. They can bring the muscle up. I do not like artificial creation of six-packs because I think that ages poorly. And then we're going to just do concentric circles here to help us when the patient's asleep on the table and filled with numbing fluid, make sure that we're able to get all that fat out. And we're also going to highlight some of these aesthetic areas to optimize that athletic look. The posterior side. So we always want to start by creating that little diamond, a gentle diamond curve or curl above the buttock. And then I like to mark where the bum starts, where the bum stops. These are important landmarks to keep. And then we mark the midline of the back. Now, her aesthetic is my aesthetic, and our aesthetic is long, lean, elegant lines. So we're going to take this waist and the bum and really scoop the waist all the way in, nice and long, so she has these really elegant lines. We're going to blend that with her outer thigh today as well. Really make her feel longer. And these are the areas that are really genetically predisposed to survive. So you can't change them really with diet and exercise. And that's where the finesse comes in. And you can see here, she has a little bit of stubborn area in the waist, and we're going to just take care of all of this on both sides to get the best look possible. To start our case, we have the massage boots on. Anesthesia is putting in the IV, getting everything ready. I always think it's important to hold the patient's hand, make them feel super comfortable as they gently drift off to sleep for our operation. One of the big upsides of having your own surgical facility is you get to curate all the equipment, all the technology, all the staff. We've really gone over the top to make sure we have, everything exactly the way we want it. The best part about being a surgeon is actually going into the operating room and doing your craft. When you do something, 10,000 times, almost millions of hours it feels like, you really just enjoy it. We listen to a little bit of music in the operating room. Everyone always asks about music. Usually it's pretty chill. Country on Fridays, a lot of 80s, a lot of 90s. The idea is just to have something on. It's not a party. But this is the best part of my day, getting into the operating room. First stage of all liposuction involves putting numbing fluid in. Number one, it's going to get the patient numb for pain relief. It has adrenaline to prevent bleeding, and the moisture helps the technology. Some people call this tumescent liposuction. Really, tumescent liposuction is just putting numbing in and getting fat out. But what you're going to see, there's a lot more to what we do than just that. Okay, after the numbing, the key step is using the Vaser machine. Now, Vaser is actually ultrasound energy. And what that's going to do is melt the stubborn fat. If it's difficult to remove with diet and exercise, you're not just going to be able to hack it away. So we like to emulsify or melt. And by doing that, we can get smoother, tighter results. So we're going to go ahead and do this all throughout the abdomen. After the Vaser, we go to the sculpting. You can see we're gently creating hill and valley concepts, paying particular attention to keep everything super smooth. All right, last stage of the sculpting before we put the drain in is the J-plasma. I really like this technology from Renuvion. Helps us apply safely a lot of heat to the underlying layers of the skin, which is going to help the collagen reorient and tighten.